Hi, I'm Lisa Strahs-Lorenc. I'm Bereavement Specialist, and welcome to the End of Life Journey Beyond the Sands of Time. Hi, Susan.
Hi, Lisa, and welcome. Thank you very much for coming today. We have a real special guest. I'm Susan Capurso, End of Life Doula and Legacy Specialist here on Long Island, New York. In New York. And today, I got to tell you, I was really looking forward to today. Today, I'm excited to have a very special guest for me and an extremely important one for everyone who listens to this video today. I'd like to welcome you today to Mary Crosby. Mary's the president and CEO of East End Hospice on the East End of Long Island, New York here. East End Hospice is a distinguished and a valued hospice on Long Island that annually provides comprehensive hospice services to more than 700 residents and their families. Mary has an extensive background in critical care, healthcare research, and project management. Mary previously held positions at Memorial Sloan Kettering Cancer Center and at the United Nations. Prior to this role, Mary worked as a hospice nurse and a nurse manager at East End Hospice in the inpatient facility, the Kanas Center for Hospice Care. Mary brings her valuable and unique qualities of caring and empathy with her every single day, enabling her to have become an asset to both the organization and to the communities of Long Island. So welcome, Mary. We welcome you today.
Welcome, Mary.
Thank
What a
you,
background
Susan.
you have. Wow.
What an intro. Thank you.
Thank you for joining us.
Absolutely.
So first, Mary, I want to say welcome because as an end of life doula that most people know on our channel, I am, but I also volunteer for your place, East End Hospice, and I'm so proud of it. So I've been with you guys for about 6 years. And it's really, it's a beautiful organization that you have there. And
Thank
I'm
you.
just very proud to be a volunteer there. But I want to know today, why did you start your career with hospice? Tell us a little bit about that.
Well, I can tell you really the defining moment for me. I think anyone who comes into this work, hospice, end of life doula work, bereavement work, usually has a calling. We hear it a lot in interviews when we're interviewing nurses and social workers. They all have this sort of calling to this work, and maybe they ignored it for some time, but eventually they listened to the calling. And for me, I was working in an oncology hospital in New York City. And I had seen a number of what I would describe as bad deaths, just deaths I worked in the basically the emergency room. And people would often come in very sick and sometimes would die there. And between them and the patient next to them would be kind of just a sheet. And maybe the person next door was listening to a football game and there was noise and the family couldn't be there and they couldn't be present. And it started to really weigh on me over time. And I was surprised by how few families had conversations about their end of life wishes, especially that being that we were in this oncology hospital where everyone had a very serious and often terminal diagnosis. But one particular shift, a woman came in, her husband was panicked. She lived about 2 hours away from the hospital in upstate New York. And she had woken up that morning and she felt very weak. She had worsened pain and a little bit of dizziness. And he didn't know what to do. It was a Saturday. Their local doctor's office was closed. So he put her in the car and drove her to Sloan Kettering. She had been told by Sloan that she couldn't have any more treatment. So she had very extensive disease and was not a candidate for any more treatment. So we did some blood work and gave her some fluids, just very basic things. And about halfway through my shift, she told me that it was the day of her son's wedding and that she and her husband had missed it to be here in this ER bay in a hospital where we weren't really doing much.
Yeah.
And I had thought, like, there's got to be a different way. And now looking back, I think it's so surprising that working there, I had almost never heard about referrals to hospice, and people didn't generally talk about hospice. And so in my mind, I was just thinking, there's got to be a better way. And now that I work for hospice, I understand, like, if she had woken up at home and didn't feel good, she would have called her primary hospice nurse, who would have come with an aide who would have bathed her and gotten her ready for the wedding, done her hair, her makeup, maybe we would have ordered her a wheelchair or gotten her different medications, but there's no way she would have missed her child's wedding, because that's so much of what we do, is preparing people for these life events and making sure they don't miss out and that they are very much living for whatever time they have left. And so for me, that was like the seed of hospice was planted.
Right.
Some time to
Right.
actually get there. I'm from the East End of Long Island, and I made the migration back home after I had my son. But something was calling to me. And so when I started to look for jobs out here, hospice kept coming into my mind, and I knew someone who was a social worker, and I reached out to her and she said, actually, we have a position available.
Wow.
And that was my kind of hospice moment. And I started as a hospice nurse.
That's a beautiful, beautiful story. And, you know, one of the biggest things with all the people that I speak to and all the events that I go to and all the educating that I'm trying to do, Mary, people, they hear the word hospice, of course, this, right? And they're afraid and they don't know exactly what it is. And, once you start talking about it, they say, wow, really? I wish I had known that, when my mom was here or dad. So can you tell us a little bit about hospice care and where do hospice services take place?
Absolutely. So hospice services, hospice is a philosophy of care. So people sometimes say, well, what's the difference between hospice and palliative care? Hospice is palliative care because palliative care is the branch of medicine that focuses on pain and symptom management. So we are palliative care, but we're palliative care as someone approaches the end of their life. And we deliver hospice care anywhere that someone considers home. So if that's in a group home, if that's in an assisted living, a nursing home, in your house, in your apartment, in your family's house, wherever you consider to be home, we provide hospice care. We also have an inpatient hospice unit in Southampton. It's absolutely beautiful. This year marks 5 years since we opened, and we provide hospice care there as well. We are all over the East End, almost 400 square miles of territory to the east to both ends of the Forks and west to about the William Floyd Parkway. And as you mentioned, we care for over 700 patients a year, but then through bereavement, which continues for a year beyond the loss of a loved one, we care for thousands more people in addition to those 700.
Wow. Yeah. So, and it is a big part of Long Island. And I know just as a volunteer, I've even had a few individuals that were a little bit beyond William Floyd Parkway, because I'm out this way. Yeah. But it's wonderful that you can offer these services. So tell us about the hospice team and what kind of care that they can provide an individual.
So hospice is an interdisciplinary team approach, which, I always say if all of medicine can be this way, we'd have a lot healthier people in general, because we all know that we aren't defined by a diagnosis or a disease, and that well-being and health have to do with our whole bodies and minds and souls and spirits. And so that's what hospice intends to do. So we bring a team of people, a nurse, several nurses, a social worker. We have volunteers, myself, Susan. We do have a pastor on who works for us, a hospice chaplain. But we also many times are helping families arrange that for that type of care through someone they know in the community. And we have home health aides who come and do personal care, getting people dressed and bathed and fed, whatever it is that they need help doing. So it is really a team approach. And while we may first begin to focus on kind of physical pain, it happens that way because we know that we can't really help people address their emotional and spiritual pain until their physical pain is kind of out of the way. So we're coming in as a team to kind of address all of these issues at once, and to figure out how to make someone feel as good as they can for whatever time they have left.
It's amazing. I have a lot of experience now with hospice, but my first experience with hospice was, I'd say, 12 years ago, 15 years ago. And my father-in-law lived upstate in Lake George, and my mother-in-law just couldn't take care of him. She couldn't lift him up anymore. It got to be too much. Right. And lo and behold, she didn't know that right around the corner was a hospice. And it was in a home that the
Mhm.
organization had built a house, a beautiful house, and nobody would have ever known the better. But when we all first heard that grandpa's going into hospice, we were like, what? Why? What? You know, and those panicky feelings
Mhm.
and scared and sad and all those feelings jump in. But then when we went up to Lake George and we went around the corner and saw this house and how beautifully they had done the house, and they
Right.
only had a certain amount of bedrooms, that
Mhm.
we knew it was the best thing. And
Yeah.
the people that were staffed there, it was just, oh, I was so in awe and proud and attracted to these people who were doing this. And most of them were in their volunteering, but you
Wow.
know, their beautiful spirits and beautiful hearts were helping so many families. There was a big open kitchen living room type thing. And one of the women every day would make a pot of chili or a
Yeah.
pot of soup or something
Right.
that, so the families always had some food coming in there. And
That's
that was
right.
my first experience. So it was a really good one. And then you were my second. So that's even
Yeah.
more perfect.
People
Oh,
also
good.
think that the person is dying immediately, and that's not the case. The case is that you're trying to have a quality of life, no matter how long the life is. And being able to bring that quality, friends visiting and relatives and all the care. For me, hospice for that last week of my husband's life was an amazing experience. Everything that you said as far as support, but beyond being able to know what was going to happen, being prepared better, and being able to fill his needs better was so important.
Right.
Instead of dying in a hospital,
Right.
and you described it. I mean, how could anybody miss their kid's wedding like that? That is just
I
the
know.
saddest thing I've heard. Sad.
I know. I
Now
know.
are you a not-for-profit organization? How
We
are you?
are. We're not for profit, and we rely very, very heavily on philanthropy. Certainly, if we had to operate based on only what we get paid by insurance companies, we would never be able to provide the superb level of care that we do provide, really going above and beyond for our patients. So we rely on community supporters quite a bit to fund our work, in addition to grants. And we have a thrift store in town that everybody loves and actually does really well to help support us. But yes, the vast majority of our revenue comes from insurance.
Mary, does hospice, does it always mean death? I mean, do you have to have that terminal diagnosis for hospice to come in? How does that work?
So you have to have a terminal diagnosis, though I think there's some often confusion about, what is a terminal diagnosis. For me personally, I never focus on this prognosis of less than 6 months because, and this kind of terminal diagnosis, because I think it's more about the goals of care. So if you have a serious illness and you don't want to go to the hospital anymore, you don't want to seek any active treatment, and you really want to focus on being at home and being comfortable, you're probably ready for hospice. Because a diagnosis like, for example, of COPD can be a very chronic diagnosis, but at some point, most patients who have COPD arrive in a moment in time when they're done going into the ER all the time and they feel short of breath and they just want to be home and be comfortable. And COPD, becomes more serious as it progresses. So I think sometimes people think, oh, you have to have a cancer diagnosis. COPD, heart failure, renal failure, a lot of the neurological conditions like Parkinson's that we're kind of seeing on the Alzheimer's, these all qualify as hospice diagnoses. Your healthcare provider does have to sign what we call a certification of terminal illness, saying that they believe you have a prognosis of less than 6 months. That being said, so many people improve on our care, and we rarely sort of graduate them from hospice at 6 months. They just have to be recertified. And then every 3 months thereafter, they get visited by our medical director or one of our nurse practitioners who will recertify them. Every once in a while, someone will graduate off of hospice, but we're so far away from meeting the target in terms of hospice utilization. New York State is ranked almost dead last in terms of hospice utilization compared to all the other states in the country. So
Why do you think that is?
Why is that?
And there's a lot of different theories, some of which have to do with New York, I mean, the short answer is that nobody knows. There is a study being undertaken right now to try to get at the heart of what that is. There's some theories that New York is a place where people come to get state-of-the-art treatment, and that we have more of a fear of death than other places, and we have even more of a focus on saving people and sort of cutting-edge medication. There's other theories that about the overutilization of nursing homes, so that patients who really should go to a hospice facility or go home on hospice are being sent to nursing homes for rehab for 30 or 60 days, which is a financially motivated decision for the nursing home, and is really, quite frankly, disturbing. There has been some actual research showing this, and anecdotally, we get calls from families who say, they discharged my mom from the hospital to rehab. She has terrible cancer. She cannot do the rehab, but they're saying she has to stay here for 60 days. Like, what can we do? And we have to almost like claw these patients out of these facilities to get them to hospice. So some of it has to do with, whether or not physicians and providers are willing to have end-of-life conversations. However, that I think is an issue across the country. So I'm not sure why New York specifically be so low, but I'm always saying to people, if you think your loved one might be ready, call us and we'll come out and assess her or him and have a conversation, because we know that in New York, the average length of stay, so the average amount of time someone is on hospice is 40 days, which is very shy of 6 months. So we're not anywhere near that 6-month mark.
Wow.
And the median is only 11 days. So we're not anywhere where we need to be. So we're not sort of at risk of getting people onto hospice too soon. We're very much at risk and are getting on patients onto hospice too late.
Yeah.
And that really affects everything, because then it fulfills this kind of cycle of, well, hospice just comes in at the very end and gives more.
That's right. That's right.
Yes,
but if people wait and we don't get called into the very end, then oftentimes the patient is in pain and we do give morphine and the patient passes, and then it sort of fulfills that prophecy that's what
right.
When we have many cases where we come in much earlier and it's a much different picture.
Oh, and when I talk to families who've had that full experience of hospice on a longer basis, they can't rave enough. They can't rave enough. Like, thank goodness that they had this in their lives. So I think it's important to stress to families and to people along the way that hospice shouldn't be feared. And it's not just that end game. And it's a wonderful asset that families need to bring in, correct?
Absolutely.
Yeah.
And that's what drives me every day. Before COVID, I was out there doing every single possible speaking engagement. And now it's great to be able to do things like this and pivot to Zoom. But, being out there talking to people, whether it's virtually or in person, about what hospice really is and what we do, is the way to break down those myths and misconceptions so that people won't be afraid. And we can build a trusting relationship with them so that, we're able to fulfill so many more of their wishes that way when we're in there.
And it's just education, like you just said, and awareness. So when one person knows, then they can tell their friend, or they can tell somebody else who may need it. And, this is it's crucial really for people to know that they can be, have this extra team of hands, and it's so important. And I think it's associated with, as far back as I can remember, is hospice. Oh, it must be the last week or two of their lives, really. And it's so wrong. It's so wrong, right?
Absolutely.
I'd like to learn more about bereavement, but I didn't know that there was bereavement afterwards. So you said up to a year.
Yeah. So all of our patients are followed for 13 months with kind of, reaching out from a volunteer or social worker to see how they're doing. But if a family member needs more assistance, we offer individual and group therapy. We offer equine therapy at a horse farm in Riverhead, which is really a beautiful, beautiful experience. We have pet therapy and music therapy for children and adults. We have a children's bereavement specialist. She's the one who runs Camp Good Grief, our camp for 4 to 17-year-olds who has lost a loved one. So we do a tremendous amount of bereavement work, and that work is entirely unfunded, so to speak, and relies on philanthropy. Recently, we received a beautiful gift from one of our supporters for our Bereavement Center. And we are building a new bereavement center to be able to provide more services in that area and to enhance the services we have for children and adults. So we have full-time bereavement staff. We respond to tragedies in the school. They call us whenever something happens in any of the school districts out here. We bring teams of people in to help the students, the staff. If a student has a tragic accident or something happens, it's really a huge part of what we do. And I think it's not nearly as well known.
Yeah, people have no idea about that.
Oh,
Yeah.
and I get the chills just hearing all these things, because I know about most of them, but still hearing them, just the fact that you go into communities and go into schools and offer this help it's life-changing.
It is. And we talk about it, it's this moment of like when grief is a normal process, but when it's not processed and talked about, then it can become pathological and it can lead to depression and substance abuse and anxiety. And how do we interject in these moments and change the course of a person's life?
Of course.
So that, and in the wake of COVID, we have been inundated, and many of the mental health organizations out here on the East End, and there are not many of them, and many of them are cost prohibitive, have waiting lists of 6 weeks because so many people are suffering with mental health issues just from the pandemic itself, from the isolation, from the anxiety of it all. And we have seen a huge increase in demand for our services, which is what's prompted us to build this new facility so we can really better serve our community. Since I think we're all kind of, collectively grieving at this point.
Now, Mary, if somebody's listening to this today and they say, well, what about financial information? Who qualifies, or I can't afford to go into, the beautiful Kanas Center that's out there. And it is beautiful, really beautiful, by the way.
Oh, thank you.
Really beautiful. So who kind of qualifies for hospice?
So anyone who has, a hospice diagnosis and qualifies, we don't deny anyone our care. If you have no insurance, if you're underinsured, it doesn't matter. The vast majority of our patients do have Medicare because they tend to be older than 65, although we care for patients of all ages. We've had several pediatric patients this year. And whatever insurance someone has, or even if they don't have insurance, we'll care for them. We don't deny anybody care. So we have some grants that we receive for what we call free care, and we rely on philanthropy for that as well. But there's no financial barrier, and we never send anyone a bill for hospice, even if the services we're providing aren't covered.
Oh, isn't that beautiful, Lisa?
Amazing.
It's so amazing.
And I'm sure so many people have no clue about this.
Yeah.
And they're trying to figure out how they're going to care for their really sick.
That's right.
So you mentioned the fundraising, and I know you do a lot of fundraising, and that's a big part of it. But tell us a little bit more about any other events that you may have, or donations, or how can they reach out to you, especially to East End Hospice, to help and assist with these things?
Okay. So as I mentioned, we are launching a campaign. And this is to build a new headquarters. So part of which will be the Bereavement Center, and part of which will be our administrative headquarters. So we've really outgrown the space that I'm sitting in now, which we've had for more than 20 years. And so we are trying to get our whole operation under one roof, aside from the Kanas Center. So we'll have the Kanas Center and this headquarters. And that's our biggest project right now. And if people are interested in that project, I would absolutely have them reach out to me at, by email or phone. I can certainly, give you that information. But in addition to this project we're launching, we have a number of annual events. Unfortunately, COVID has kind of put a wrench in many of them. We have a gala every year. It's about 600 people on a private estate in Quogue. It's a tent party where we share a little bit about our program, and we usually have a speaker, someone who's benefited from our services. We have not had it for the last 2 years. Fingers crossed we'll have it this summer. It's always the last weekend of June, so stay tuned. We have another fundraiser. We have one fundraiser in New York City to support Camp Good Grief. And that is usually in February, but this year is being pivoted to May because of the pandemic. And that's called the Valentine's Salon Luncheon, although now that it's in May, I think maybe it'll be called something different. And we have a number of smaller cocktail parties and get-togethers. If anyone's interested in being on our mailing list, they can email info@eeh.org, and we can keep them updated on all of our events. And we do quite a bit of mailings as well, where we try to tell patient stories and tell family stories and really get the community engaged in the work we're doing. And we've done quite a bit more of that since the pandemic, since we really can't gather in person.
Yeah, and they're beautiful newsletters, and you do have other little events where I've seen where you've had a few Zoom things going on, and you invite everybody to come and be a part of. So that's really nice. And if you want to get involved, it's very easy to get involved, and you just have to take the step and reach out. And I'm sorry I interrupted you, Lisa.
Why don't you give your website and also then your contact information? That would really help too.
Okay, so our website is www.eeh.org. So, anyone, and our phone number for our main office is 631-288-8400. And as I mentioned before, if anyone wants to send an email, you can send it to info@eeh.org, and someone will get back to you if you're interested in volunteering or coming to an event, more about hospice. Those are the best ways to get in touch with us.
Wonderful. Mary, is the new center that you're building, is that right near the old one? Is it in West Hampton?
It's going to be in West Hampton. So right now I'm in our main office. It's going to be up the road from here, a little bit closer to the Kanas Center. We bought a piece of property and we are building around a 13,000 square foot building. Like I said, half of it, it'll be kind of split in two, and half will be the bereavement center, where we hope to have indoor, outdoor space for children and adults bereavement, a studio for yoga and breath work and music therapy. And then the other side will really be what I call the engine of our organization, which is really the where the nurses come to get supplies, where we have our team meetings, where the administrators are, where, kind of our hub, which is the building I'm in now. So we will also bring our fundraising staff into that building as well. So right now we're kind of spread out, and we're hoping to get under one roof. But again, the focus is really on the bereavement. We're seeing this increased demand for bereavement, and we want the to do it. Right now, our bereavement therapy services are provided in a less than ideal space that's in a shopping center. It's a rental space. There's no light, there's no windows, there's no privacy. And we really want to be able to amplify those spaces and those services.
That's wonderful.
Wow.
Wow. I'm so happy to have you here today. You don't know. This is such an important piece of what Lisa and I talk about every week, and it's really good for people in New York to know that you're there and what you do, and the incredible services that you offer that most people, I would say, don't know about.
Right.
Yeah.
Right.
Did you have anything else, Lisa? I know that I did most of the talking. I'm sorry.
No,
I was excited.
No, that's okay. I certainly believe in hospice, and I know its value, but I didn't know all the services that you had out east.
Yeah. And thanks for having me. The work that you do is wonderful, and I look forward to opportunities we can have to partner together and to continue to provide support to families as they face end of life experiences. And I appreciate this platform to be able to share.
Oh, you're very welcome. You're
Thank
very
you.
welcome.
Really
Lisa,
love that.
tell us.
Yes.
I know, Lisa, you have a couple books, right?
Sure. In our spare time, my husband died of pancreatic cancer 12 years ago. So my pet project, or my passion project, is Lustgarten Foundation, because 100% of the monies go towards pancreatic cancer research.
Oh,
so
wow.
my two books are support books. One is Pancreatic Cancer, It's a Family Affair, and the other is Pancreatic Cancer, Families Move On. And you can find out more about it through Amazon, just by researching my name, or www.familiesmoveon.com. So that's what I do. And I'm also a bereavement specialist, and having lost a lot of people very early in life, actually starting at age 2 and going up from there. I lost my mother when I was 2. She was 26 years old. Yeah, some really interesting experiences shaped me for who I am now, and celebrating life. because
That's
I
right.
don't feel sorry for myself, and I celebrate everything that I have in my life and everyone who's been in my life, even if they've been there for a short period of time.
That's right.
So I like working with people and trying to help them grieve, as you said, in a way that's helpful and positive to them and celebrates the people who they loved and keeps them still close to us, all of
That's
us.
great. That's
So,
really great.
thank you.
And
And Susan?
besides the YouTube channel Lisa and I do together, we also help people with life celebrations, planning and
Oh,
and
great.
yeah, that we have a nice time doing that, and the families do as well. And I'm an end of life doula, but I love the legacy part of it. And to leave your
Yeah.
stories and memories and experiences is really, really important for me. So I did this so much at the beginning before a person passes. And then I was approached even by healthy and vibrant people who want to leave their stories and memories as well. So
Yeah.
if you go to eastenddoulacare.com, you'll find, and no relation, it just worked out that way with our names, but you'll see my books on there, the legacy project that I do with the different books. I help you create your own books with photos and text. And the couple books I have, Coming Full Circle, 100 Tools, Tips, and Ideas to help you at the end of life when you have a terminal diagnosis, and Remember Me, the Story of My Life, where I offer prompts and take you back to a certain memory in time so you can leave your stories on the pages of that book. And you can find all those on eastenddoulacare.com. And I also created a few online digital courses. You see eastend.academy up there to help with end of life. And Lisa and I just put one on there together. And tell us
What does a
about that.
dying person want? How's that?
Wow. That's
So
great.
that's really important. And
I
we
look
just
forward
love
to checking that out.
yeah, we love to offer valuable education and tools and tips for the family and the person experiencing this milestone.
We'd love to
Absolutely.
work with you. If there's something that
Yeah.
we can all do together, we'd love to do that. And
That
if,
would be
if there's
great.
anything I can do bereavement wise, I'd be more than happy to
Oh, wonderful.
come and talk and
great.
share. And especially with the holidays coming up and stuff,
Mhm.
very difficult and challenging during
I
the
know.
holidays for people to adjust. And I help them
Absolutely.
embrace their loved ones and the people who, even though they're not here anymore, they can still be celebrated.
Yeah,
So
That's right.
that's great. And we do a coping through the holidays program every year. I think it's going to be Zoom again this year, but I'll have to. It was supposed to be in person. Now it's pivoted to Zoom. But yes, I think there's so much space for us to collaborate and work together. You know, it's just anyone who works in the space of dying and bereavement is always very special to me. And I think, like I said, we all come here from.
Oh, the more people to help, the better. That's
Yeah.
what I think.
yes,
So
me too,
thank you,
me too.
Mary. Thank you
Mary.
Thank you,
so
Susan.
much
Thank
for
you,
coming
Lisa.
today.
I appreciate
Great
it.
meeting you, Mary.
Nice
And thanks
meeting
so
you
much
too.
for the
Thank you so
important work
much.
that you do.
Great
amazing work.
information.
Thank you for the
You
work
too.
and thank you
Thank
for the
you.
organization. Okay, take care.
Absolutely. Bye.
Bye.
Thank you.